and we can ride the boogie. Share that beat of love. I wanna rock with you.
Hi everyone! Today I am here to discuss and demonstrate how to first aid open wounds. So let us first define what an open wound is. An open wound is an injury that involves an external or internal breach in bodily tissue, most commonly the skin. Open wounds are divided into several classifications. First is a puncture wound. Sharp and pointed object penetrates the skin, providing a puncture wound. Abrasion occurs when the skin is rubbed, scraped against rough surfaces. Laceration occurs when the skin is ripped by a sharp object with irregular edges. Avulsion tissues are ripped out from the body. Incision skin and tissues are cut by a sharp-bladed instrument. So let us now check on what is inside of our first aid box. First, we have gauze pad. Gauze pad is a thin piece of material used to cover wounds. Next, we have medical tape. Medical tape used in medicine and first aid to hold a bandage. Next, we have band-aids. It is a sticking plaster of a type having gauze pad in the center, used to cover minor wounds. Next, we have pieces of cotton. Cottons are used for a surgical dressing. Then we also have alcohol. Alcohol is used to disinfect the skin of the person and the hands of healthcare providers. Next, we have medicines compound or preparation used for treatment or prevention of disease, especially a drug or drugs taken by mouth. We also have betadine, which help treat and prevent infection in minor cuts, scrapes, and burns. Next, we also have ice hot compress, which is often best for short-term pain like sprain or strain. And lastly, we have gloves. Gloves is to protect the wearer and the patient from spreading the infection. So these are all the things inside of our first aid box. So now we are ready to perform the first aid on open wounds. The first thing I did was to obtain consent from the wounded person. Then I checked to see if the injury was severe. After checking, I discovered that it is an abrasion wound. Since it is a minor open wound, we do not require the assistance of medical professional. I cleaned the wound with alcohol first. Then open the betadine and pour into fresh cotton. I used the gauze pad to cover the open wound injury. After applying the betadine to it, I gently applied the gauze pad to the open wound and then used medical tape to dress it. To avoid infections, I now make sure that the side of dressing is clean and free of dirt. As a result, the patient is no longer at risk of infection from her open wound. There are also certain things that we should not forget. If the bleeding is severe, it is critical to get medical treatments since an open cut can be dangerous, such as hemorrhage, infections, and lastly, shock. We must not forget that if a serious accident occurs, we must seek the assistance of an expert. So this is my performance video in first aid. Thank you for watching.